Youth are the most important actors in their healthcare. When health center staff encourage, acknowledge, and incorporate youth perspectives, they exemplify a healthcare system that values collective input, patients' rights, and the holistic success of children and adolescents, ensuring youth have a voice, influence, and place in their communities. Engaged young people are passionate clients who can serve as liaisons between the health center and new patients. They are a key resource in promoting a positive image of a health center to their peers, an image that emphasizes safety, friendliness, and trust. But how can health centers support and harness the enthusiasm and influence of engaged young people? Effective recruitment strategies are essential to ensure their active participation and connection with the health center. Recruitment and retention are vital components of a health center's youth work. Strategies to recruit youth and keep them engaged should be created early when developing a youth engagement program and carried into implementation. Successful recruitment strategies rely on the health center staff's familiarity with the school, the larger community, and their ability to cultivate leadership in youth from different academic, socioeconomic, and cultural backgrounds. Before recruitment can begin, adult coordinators must understand the purpose of their youth engagement efforts and how youth-driven these efforts will be. Also, be mindful of taking on a guiding role for a young person who may be new to youth leadership work, and facilitate a peer-to-peer partnership to ease their transition into outreach and engagement efforts. Recruitment efforts can take place in a variety of settings throughout the community. The first place to look is within the health center. Youth who frequent and already have a relationship with your health center may be the start of a genuine partnership because of their familiarity with the center and its services. This can provide a continuous, engaged pool of participants that offer relevant insights. Collaborate with local schools to engage students directly. This can be an effective way to reach a diverse group of young people and ensure a variety of perspectives are represented in your initiatives. If your health center has school-based sites, these locations can be a great place to start. Both students seeking leadership roles and those who may have demonstrated little involvement in activities could benefit from this meaningful youth development opportunity. Set up tables, booths, or interactive sessions at community events to attract a broad audience. These events are great opportunities to connect with youth who might be interested in participating but are not yet engaged with the health center. There are many recruitment strategies health centers can utilize to engage and interest youth. Design eye-catching posters highlighting the benefits of participating and how the youth input will be used. Place these posters in strategic locations where young people frequent, such as schools, community centers, and within the health center itself. Utilize existing newsletters within schools or community organizations to reach both youth and their parents. Include detailed information about the purpose of this partnership and how they can get involved. Encourage current or past participants to spread the word among their peers. Word of mouth can be a powerful tool, especially when trusted individuals and friends endorse the program. Consider finding 1 or 2 early adopter youth who can serve as recruitment leaders. Leverage social media platforms that are popular among youth to share information, engage in conversations, and build a community around your initiative. This method can rapidly increase visibility and interest. If your health center has a social media account, use that to start marketing this opportunity. When your initiative or opportunity expands and grows, you may want to start a social media account dedicated to sharing important updates.
So the current projects I'm working on are in partnership with our county's primary community service program, and that is a partner of our health center. Essentially, I'm working with the Positive Youth Development Hub to create and spearhead a youth council. So there have been some obstacles that have come along with this, and that has to do with a lack of awareness on the issue. So far I'm the only youth leader who is working with the adults to try to create this council. And I have a few ideas on how I can engage more youth members. And that starts in my school and in nearby high schools. So as a part of my school's diversity club, I plan to organize an assembly to speak on how race affects healthcare inequity. And I feel like this could really spark an interest in many of the members of my club, but also outside of the club. And then I would provide them with the opportunity to join this youth council. In addition to that, I have been working on certain writing pieces to, again, spread awareness, and I'm hoping to publish them on a forum where many teens have access to it so that it's getting to the audience that I want it to reach. Also, just going around and speaking to other high schools and people who may be interested in promoting the kinds of things that I'm promoting, but also people who might actually need greater healthcare access. Furthermore, it's difficult for youth to become involved in policy making. However, youth leaders are essential for outreach. We can educate adults and our peers on the resources which exist. Spreading awareness is what can truly change a person's life. Simply knowing what's out there and providing someone with comfort and resources that they need is such a powerful thing and really makes you involved in your community and your health center. Spreading education is spreading hope, and that's why I love what I do.
When building connections with youth, it's important to establish expectations. Clearly define the roles, goals, and responsibilities for everyone involved. Setting clear expectations at the outset ensures that all parties are aligned and understand what is expected of them throughout the process. Motivate participation and engagement by offering incentives that are valuable to those involved. This can range from providing stipends and wages to opportunities for personal growth and development. Regular and reliable communication is crucial. Meet and communicate constantly and consistently. Schedule consistent meetings and provide regular updates to ensure everyone is informed and is able to provide feedback. This will help maintain momentum and clarity. Make it practical to obtain and incorporate youth input. Streamline processes to make it easy for young people to provide their insights. Ensure that the methods used to gather input are accessible and considerate of their perspectives and realities. Adopt evidence-based frameworks and measures for youth engagement. Building strong, lasting relationships that go beyond the superficial begins with viewing youth as equals. This involves listening actively, respecting their views, and showing a genuine interest in their experiences and ideas. Including young people you work with in conversations with health center leadership will sponsor an environment where young people feel valued and essential to your mission.
When we were doing a community event, helping people provide vaccinations and community care in an underserved area. We were running an event on a Saturday. We had everything planned out. We had a booth set up. We had flyers, forms, and educational information for people to read as soon as they stopped by our booth. But we sat for hours and hours and we were getting no engagement. Nobody wanted to stop by our booth and fill out this specific form and flyers and learn more about how they can receive community care and get tested for blood pressure and check if they're up to date on their vaccines. And we just couldn't get any engagement. So we were trying to brainstorm different ways in order to make this work because it had been an hour or two by then. One thing we did brainstorm was providing an incentive and an interactive activity at our booth, which then increased our engagement by double or triple immediately, almost immediately. So with regards to the interactive activity, we just had a fun game on the side going on where people who wanted to stop by our booth could try to play the game. And if they won in the game, then we'd give them a free prize or incentive. And that way, people had more initiative and incentive to stop by our booth and learn more about the initiatives that we're providing and the specific care that we're providing. And a lot of people got their blood pressure tested that day. They filled out many forms to learn if their vaccinations were up to date. And it was all because of the fact that we offered an interactive activity as well as an incentive to those who were coming and stopping by. So this lesson kind of taught me that it's really, really important when working on engagement that you try to engage the audience through incentives and interactive activities, and just having a booth set up with information on a desk will not gather any patients or people, and you won't have any traction unless you really, really try to interact with them, talk to them on a personal level, and just like have fun with them, play a game with them, just get to know them better. And so I found that was like a success story that happened. And eventually we were able to get a lot of people at our booth, even though we weren't initially.
Implementing these practices will create a strong framework for engaging young people in meaningful ways and establishing and sustaining youth development programming at your health center. Remember, engaging young people in your outreach efforts requires having a plan for recruitment and establishing and sustaining connections that benefit both your health center and youth. As valued stakeholders, youth can be instrumental in creating effective and inclusive policies, programs, and environments. Check out the other videos in the Creating and Sustaining Adolescent-Centered Health Program series.